हाय एवरीवन, वेलकम बैक टू स्टडी विथ मी ब्लॉग्स। ओके, सो आज हम पढ़ेंगे ह्यूमन एनाटॉमी, जनरल एनाटॉमी बाय बी डी चौरसिया। ठीक है, हैंडबुक ऑफ जनरल एनाटॉमी। ठीक है, इस चैप्टर को, चैप्टर नंबर 1 को जो इंट्रोडक्शन होता है, इसे मैं एक बार टोटली ख़त्म कर चुका हूँ, लेकिन कुछ चीज़ अभी भी मैं भूल गया हूँ। ठीक है, तो उसे दोबारा रिवाइज करने से इसे हम तब तक करेंगे जब तक हमारे दिमाग में ये एक क्लियर क्रिस्टल एक इम्प्रिंट ना बन जाए। ठीक है, तो शुरू करते हैं। ह्यूमन एनाटॉमी इज द साइंस which deals with the structure of a human body. The term anatomy is derived from a Greek word anatom, meaning cutting up. The term dissection is a Latin equivalent of the Greek term anatom. However, the two words anatomy and dissection are not synonymous. Dissection is a mere technique, whereas anatomy is a wide field of study. Anatomy forms firm foundation of the whole art of medicine and introduces the student to the greater part of medical terminology. Anatomy is to physiology as geography is to history. That is, it describes the theater in which the action takes place. Subdivision of anatomy. Initially, anatomy was studied mainly by dissection, but the scope of modern anatomy has become very widely mm, because it is now studied by all possible technique which can enlarge the boundaries of the anatomical knowledge. The main subdivision of anatomy are cadaveric anatomy is studied on dead, embalmed or preserved bodies, usually with the naked eye. मैक्रोस्कोपिक, और इसे बोला जाता है ग्रॉस एनाटोमी। This can be done by one of the two approaches. In regional anatomy, the body is studied in parts like upper limb, lower limb, thorax, abdomen, head and neck, brain. In systemic anatomy, the body is studied in system like skeletal system, जिसे ओस्टियोलॉजी कहा जाता है, मस्कुलर सिस्टम, जिसे मायोलॉजी कहा जाता है, आर्टिकुलेटरी सिस्टम, आर्थ्रोलॉजी, सिंडेस्मोलॉजी, vascular system, angiology, nervous system, neurology, and respiratory, digestive, urogenital, endocrine systems, that is splanknology. The locomotor system inside include osteology, arthrology, myology. These systems are briefly mentioned close to the end of this chapter. Living anatomy. Living anatomy is studied by inspection, palpation, perfusion, auscultation. Auscultation मतलब स्टेथो, palpitation मतलब ऐसे, perfusion मतलब प्रेशर। ओके, एंडोस्कोपी, एंडोस्कोपी में आपका ब्रोंकोस्कोपी, गैस्ट्रोस्कोपी, रेडियोग्राफी, इलेक्ट्रोमायोग्राफी एक्सेट्रा, एम्ब्रियोलॉजी, और इसे बोला जाता है डेवलपमेंटल एनाटोमी। is the study of a prenatal developmental changes in an individual. The developmental history is called as ontogeny. The evolutionary history, on the other hand, is called as phylogeny. एम्ब्रियोलॉजी और इसे बोला जाता है डेवलपमेंटल एनाटॉमी is the study of a prenatal development changes in an individual. The developmental history is called as ontogeny. The evolutionary history, on the other hand, is called phylogeny. Histology or microscopic anatomy is the study of a structure with the aid of a microscope. सरफेस एनाटॉमी और इसे बोला जाता है टोपोग्राफिक एनाटॉमी is the study of a deeper part of the body in relation to skin surface. Example, palpating the artery. It is most important in clinical practice, physical therapy and surgical operation. Example हो गया palpating the artery. All epithelial cells are simple columnar in type. Parietal cells are large and pink. Large and pink. Chief cells are small and blue. Duct is 1/3. Secretory part is 2/3. Radiographic and imaging anatomy is the study of bones and a deeper organ by plain and contrast radiography, by ultrasound and computerized tomographic CT scan. Comparative anatomy is the study of anatomy of the other animal to explain the changes in form, structure and function, morphology of a different part of the human body. Physical anthropology deals with the external feature and measurement of different races and group of people and with the study of prehistoric remains. Applied anatomy जिसे बोला जाता है clinical anatomy deals with the application of anatomical knowledge to the medical and surgical practice. Experimental anatomy is the study of a factor which influence and determine the form, structure and function of a different part of the body. Genetics deals with the study of information present in the chromosomes. यहाँ पर कुछ नहीं. Anatomical terminology. Various position plane terms in relation to various region and movement are described. Okay. Anatomical position. When a person is standing straight with eyes looking forward, both arms by side of the body, palm facing forward, both feet together, the position is anatomical position. Supine position, when a person is lying on his or her back, arms by the side, palm facing upward and feet put together, the position is called supine position. Now prone position. Person lying on his or her face, chest, abdomen is said to be in prone position. Lithotomy position. Person lying on her back with legs up and feet supported in straps. This position is mostly used during the delivery of the baby. Planes. A plane passing through the center of the body, dividing it into two equal right and left halves, is the median or mid-sagittal plane. Plane parallel to the median or mid-sagittal plane is known as sagittal plane. A plane at right angle to sagittal or median plane, which divide the body into anterior and posterior half, is called as coronal plane. A plane at right angle to the sagittal or median plane, sagittal or median plane, which divide the body into anterior and posterior halves, is called a coronal plane. A plane at right angle to both sagittal and coronal plane, which divide the body into upper and lower part, is called as transverse horizontal plane. Oblique plane क्या होता है? Any other plane other than coronal transverse mid-sagittal is called oblique plane. Cardinal plane. If any plane traverses the center of the body, it is called as cardinal plane. Some other terms. Fundamental position. It is same as anatomical position except that palms are facing the body. It is a comfortable position and is not important from anatomical point of view. Center of gravity. The point where three cardinal planes intersect in the body is called center of gravity. Term used in relation to trunk, neck and face. थोड़ा नींद ज़्यादा लग रहा है, ठीक है। तो टर्म यूज्ड इन रिलेशन टू ट्रंक, उसके बाद नेक, उसके बाद फेस, ये हम अगले क्लास में देखेंगे। थोड़ा मुझे नींद लग रहा है, ठीक है। तो पढ़ने में भी कोई इच्छा नहीं लगेगा, ज़बरदस्ती मैं कभी पढ़ता नहीं हूँ। आज के ब्लॉग के लिए इतना ही। थैंक यू।